As the law enforcement approach continues to fail, a growing number of countries allow a medical approach to hardcore drug addiction. LEAP's Neill Franklin recently visited a supervised injection site in Vancouver. Patients provide their own street-bought drugs.
People are injecting in the alleys, they are injecting in the public toilets of this city. Province-wide, we had 38 overdose deaths in 1988, and that went up to like 410, like more than one overdose death per day in this province 10 years later. Insite is part of an effort to bring that curve back down. And what we cater to, our primary group, are the most addicted people in society, concentrated right in this low-income area. People like Pearl, you'll talk to. Yeah. This incredibly lovely woman who has this incredibly challenging life. She is often poorly housed and in and out of decent housing around here. She's also got family that she's constantly worried about. She has all these emotional burdens on her, but she is this incredibly sweet person who is really struggling with her addiction, with the pain of her past, and with the complexities of her present. She doesn't need to be put in jail. She's not a criminal. She's in fact this incredibly strong and vibrant and loving person who needs health care, who needs friendship, and who needs support. She needs access to Insite, and she needs access to Onsite, which is the detox right above Insite.
Cleaning the site, you gotta make sure you clean your site so you don't put, stick germs in when you're pushing in your,
And in the event of overdose, you get a very quick response from the nursing staff with oxygen, with Narcan, that prevents death, basically. And we have never had an overdose fatality at Insite. Thousands and thousands and thousands of safe injections have been provided here without any fatalities. This place also helps reduce the spread of HIV and hepatitis C, helps reduce soft tissue infections. It does that with clean equipment, safer injection education, with things like running water and soap. Some of the healthcare, most of the healthcare that goes on here is incredibly basic. But people who are addicted and injecting in the alleys and in the doorways, they have no access to any sort of healthcare. And Insite is part of a program to try and redress that, to bring people who are marginalized out of society, back into society, back into the light of healthcare.
In 2003, our research group was contracted to conduct an independent arm's-length scientific evaluation of Insite, Vancouver's supervised injection facility. After 8 years of evaluation, there are now over 40 studies published in some of the world's leading medical and public health journals, including the New England Journal of Medicine, the Lancet, the British Medical Journal, and the American Journal of Public Health. These studies show conclusively that Insite has succeeded in fulfilling its objectives. It has been shown to reduce public disorder by reducing the number of people who are injecting in public places. It has also been shown to reduce HIV risk behavior, such as syringe sharing. As well, there has been a greater than 30% increase in the use of detoxification programs, and as well as increased uptake of other forms of addiction treatment. As well, in a study published in The Lancet in 2011, we showed that within 2 years of Insite opening, there was a 35% decline in overdose deaths in the area around Insite. We have also published a number of studies showing that the establishment of Insite did not lead to increases in crime, it did not make drug use patterns in the community worse, and nor has it prompted individuals to initiate injecting by making the conditions for injecting comfortable.
Here's what they say is, I'm giving you a chance. You get your ass over to Insite right now and get involved with that. The police know it makes sense. It makes their job easier. The local business associations in Chinatown and in Gastown, before we opened the site, they were like, no, let's not do it. It's going to have a honeypot effect. It's going to be drawing people and users to this area. And it hasn't done that. Right. So in the end, they've actually come forward and said, you know what? This has worked. And I support it.
It's safe here. I've actually OD'd a couple of times where they saved my life, and thank God I was here, as not in an alley somewhere. Right. About 3 times a day, at least.
So that's 3 times a day that you're not out in the street somewhere in some alley.
3 or 4 times where I'm not outside, where it's just not safe. The cops are around, other people, because I was, because it was easy. I was vulnerable. People were taking advantage of it.
What about the future?
The future. future.
What do you see as far as the future
For
for
me,
you?
the future is there is a detox upstairs, right? And I've been there a couple of times, and each time I go, I pick up something new. There's something changes in my life. So I've actually been putting in my name to go back upstairs because I plan on not using, I want to change. My life's going to change.
So it's a process for
It
you.
is a process.
And you're going to do it. You're
Yes,
going
and I'm going to do it.
to God love you.
Thank you.
Thank you. We're going to take your story back to the States so people can understand that this is a medical situation for you. This is a health issue for you.
Join us. You still have you're a human being that has a disease.
So to simply bring people into a clean facility, to make a bond with them, to build trust with them, it does nothing but good. It reduces people's usage over time, it makes them use smarter, it makes them use safer, it makes them think about detox. It doesn't draw people to addiction. What it does is try and draw people out of addiction. So it actually makes sense in just about any community.